Video we will cover upper limb anatomy and the structures. In this image we can see superficial veins of upper limb anteriorly. These are the superficial veins of upper limb: cephalic vein, median cubital vein, basilic vein. And the next image shows us forearm and hand laterally, and we can see antebrachial fascia. Antebrachial fascia. Now the next image which shows us upper limb posteriorly, and this in this we can see tricep brachii long head, okay, and deltoid muscle clearly. This is deltoid muscle, upper one, and this one is tricep brachii long head. So this was the image of upper limb posteriorly. Now the next image which shows shoulder posteriorly. Shoulder posteriorly. In this figure we can see again the tricep brachii muscle long head. Tricep brachii muscles long head, and posterior circumflex humeral artery. Posterior circumflex humeral artery and axillary nerve, and deltoid muscle which is reflected here. So this was the shoulder posteriorly. Now the next image of cadaver, arm anteriorly, which shows us bicep brachii muscles long head and biceps brachii muscles short head. The upper one is deltoid muscle. Now the next image is arm anteriorly again, bicep brachii muscle tendons which are cut here, and musculocutaneous nerve and coracobrachialis muscle. Coracobrachialis muscle and brachialis muscle. Okay, so this is arm anteriorly. The next image is arm anteriorly, musculocutaneous nerve, coracobrachialis muscle, and brachial artery and vein, ulnar nerve, and the front one is median nerve. Now the shoulder and arm posteriorly. Where we can see tricep brachii muscles, long head and lateral head, and the deltoid muscle and teres major muscle. The next figure, shoulder and arm posteriorly, tricep brachii muscle, medial head, tricep brachii muscle, long head, tricep brachii muscle, lateral head, and deep artery of arm and radial nerve. Now we are going to the next image, superficial layer of flexures anteriorly. This is very important, flexure carpi radialis, okay, and flexure carpi ulnaris muscle tendon, and palmaris longus muscle, and pronator teres muscle, common flexure tendon. Now the next figure shows forearm anteriorly, where we can see ulnar arteries, and the ulnar artery which is present here, and the radial artery. The upper one is brachial artery. Superficial layer of forearm anteriorly. Flexor carpi ulnaris, palmaris longus muscle tendon, pronator teres, flexor carpi radialis muscle. Intermediate layer of forearm. Flexor carpi ulnaris tendon and flexor digitorum superficialis muscle. Palmaris longus muscle tendon cut, which is cut here in this image. Now the next deep forearm layer of anteriorly, where we can see flexor digitorum profundus and flexor pollicis longus muscle. Flexor digitorum profundus and flexor pollicis longus. This is deep forearm layer of anteriorly. Now the next is deep forearm anteriorly. Ulnar artery we can see, and common interosseous artery and posterior interosseous artery, anterior interosseous artery, pronator quadratus muscle, interosseous membrane of forearm. Okay. Now the next one is superficial layer of forearm. Posteriorly. Now posteriorly we can see extensor retinaculum very clearly. In the superficial layer forearm posterior we can see extensor retinaculum, extensor carpi radialis brevis, flexor carpi radialis longus muscle and brachioradialis muscle. On the other side we can see anconicious muscle, extensor carpi ulnaris muscle, extensor digitorum muscle, extensor digiti minimi muscle. So these are superficial forearm posteriorly, superficial layer. Okay. Now the superficial layer of forearm posteriorly, ulna we can see here, and common extensor tendon and ulnar nerve. In the next figure we can see supinator muscle upward, in the upward direction, and deep layer of forearm contains supinator muscle, abductor pollicis longus muscle, extensor pollicis brevis and external pollicis longus, and extensor indicis muscle. So this was all about upper limb images of cadaver.